16 bodybuilders who died of kidney failure. Number 1. Andreas Munzer. Andreas Munzer was an Austrian pro bodybuilder who died in 1996 due to liver and kidney failure and other complications. The bodybuilder's autopsy revealed he had almost 0% body fat at the time of his death, and experts suggested this could have played a role in his demise. The autopsy found traces of about 20 different drugs along with acute toxicity. Number 2. Nasser El Sambadi. Nasser was one of the great bodybuilders who didn't manage to win a victory at Mr. Olympia. The professor lost his life in the March of 2013 due to kidney failure and heart complications at the young age of 47. Number 3. Sergio Oliva. Sergio Oliva is famous for winning the Mr. Olympia title for 3 consecutive years. The myth was ill and under dialysis treatment prior to his death. Oliva died of kidney failure on November 12, 2012 at the age of 71. Number 4. Paul Grant. Paul Grant was a Welsh bodybuilder from the Golden Era who trained with the likes of Arnold and Lou Ferrigno. At the age of 30, he was diagnosed with a serious kidney disease. This affected his eyesight and he had to spend 3 days per week, 8 hours a day, attached to a dialysis machine. Paul died at the age of 60 on November 23, 2003. Number 5. Ray Menser. In 1999, Ray discovered he had kidney problems. He died from kidney failure, a complication resulting from Berger's disease, after missing his kidney dialysis treatment. Number 6. Scott Klein. 4-time NPC heavyweight competitor Scott Klein died from kidney failure in 2003 at the age of 30. Number 7. Luke Wood. Luke Wood, a 6-time winner of the Australian Bodybuilding Championships, died on August 31, 2011, 11 days after he underwent kidney transplant surgery. Number 8. John Riggins. John Riggins was widely popular on the bodybuilding circuit and among muscle fans thanks to that spectacularly bulging physique. John collapsed at Penn Station and was dead by the time they got him to the hospital. His kidneys had failed and he was unable to hold on for a transplant. Number 9. Lawrence Marshall. IFBB pro Lawrence Marshall will be remembered as a legendary bodybuilder and the trainer of trainers. He had kidney problems, which eventually took his life after kidney failure at the age of 58. Number 10. Phil Hernon. Phil Hernon was an IFBB pro bodybuilder who sadly lost his life due to medical issues for years at age 55. He'd been struggling with health issues as he was on dialysis. Phil Hernon had kidney troubles for years and needed a kidney transplant, but he had a sudden decline in his condition, which ultimately led to losing his life. Number 11. Robert Louis Rothrock. Bodybuilder and former junior Mr. America Robert Rothrock passed away on June 25, 2022 due to kidney failure. He was 59 years old. He was probably best known for having beaten Flex Wheeler in competition early in his career. Number 12. Asal Jaburi. An Iraqi bodybuilder, Muhammad Asal Jaburi, passed away at a relatively young age. According to the Iraqi media, the cause of death was due to kidney failure as a result of taking muscle-inflating hormones, probably side enhancement oil, which damaged his kidney and ultimately he lost his life. Number 13. Raymond Patrick Pierce. Raymond Patrick did both bodybuilding and powerlifting. He had years of chronic blood pressure, which led to kidney issues. His kidney failed in 2019, and since then he was on dialysis. In May 2021, Ray received a kidney transplant, and less than a year later, due to a compromised immune system from taking the anti-rejection medicines, in January 2022, Ray was diagnosed with Merkel cell carcinoma, which is a rare type of skin cancer, and it took him down very quickly. He passed away on the 19th of December 2022 at the age of 50. Number 14. Rick Drayson. Rick Drayson, a legendary figure in bodybuilding, movie stunts, and professional wrestling, has died at the age of 76. He was being treated in a hospital for a kidney problem when he passed away. Number 15. Boston Lloyd. Boston Lloyd's a bodybuilder who gained tremendous fame over his controversial videos on his use of steroids, site injections, synthol, peptides, and other PEDs. Boston had stage 5 kidney failure and his cause of death was triggered by an aortic dissection. Number 16. Michael Big Kentucky Thier. Michael Thier was a bodybuilder loved by many in the community. He dedicated his life to service for the benefit of others. Michael was a soldier who fought in the Bosnia 1996 war and the 1999 UN Mission Ethiopia War. Mike passed away on the 21st of February 2021 due to kidney failure.